Uncompensated health care in Wisconsin hospitals was $1.28 billion in 2022. That's according to the Wisconsin Hospital Association's report on uncompensated care for 2022, released at the end of 2023. Uncompensated care is made up of bad debt and charity care. About $697.5 million of the uncompensated care was bad debt, while $582.6 million was attributed to charity care expenses. We're showing you on the screen what that uncompensated care looks like over time in Wisconsin. Quite a dip around 2015, then creeping steadily back up, and not as big a drop as you would expect during the COVID pandemic. The slight drop in 2022 is attributed to some of the federal rules that mandated people keep their health care coverage during the COVID pandemic, at least for state Medicaid programs. You would expect uncompensated care to have dropped significantly with more people having access to that Medicaid, but it didn't drop as much as we expected. We're looking at the numbers now on the chart, those trend lines for bad debt and charity care over time. And here's what those trend line data is actually telling us. Bad debt for Wisconsin hospitals did decrease a little bit from 2021, but bad debt is still 2% higher than pre-pandemic year 2019. Similarly, charity care provided services increased slightly over the previous year, but charity care is still 7.6% lower than pre-pandemic 2019. In fact, when compared to pre-pandemic year 2019, hospital charity care dollars have dropped by almost $50 million. Now, we are keeping an eye on nonprofit hospitals, and it's actually a topic nationally. Nonprofit hospitals receive federal and state subsidies and tax exemptions. In return, they're expected to provide what is called community benefit, and charity care makes up a big chunk of that community benefit. According to that Wisconsin Hospital Association report, charity care for all reporting hospitals only averaged 0.7% of gross patient revenues. Wisconsin families still face that heavy burden of debt, and some of these tax-exempt hospitals and healthcare systems pursue folks with aggressive debt collection practices. Now, there's something hospitals can do to improve. Proactively help patients at the start of a relationship. Encourage strong consumer assistance and protections within their own facilities. Get some trained staff that understand Medicaid programs, enrollments, how to bill insurance correctly, help connect patients to coverage when it's available, and know some of those federally required charity care rules and options, and certainly uncomplicate the whole process. But hospitals aren't the only ones that have a stake in this. There's some things Congress can do. They can ensure that hospitals are offering charity care at levels consistent with their tax breaks. They can establish clear and enforceable standards, and they can certainly enforce those IRS regulations that are already on the books. We link to that Hospital Association report in the description below.